Hi, welcome back to Recovery Road. I'm Julie Lenyk, Director of Recovery Support Services from Meridian HealthCare.
And I'm Meghan Fawcett, the Vice President of Clinical Treatment with Meridian HealthCare.
And we're just here to answer some questions, some common questions that we get from individuals who are interested in the treatment and recovery process. And one question that we often get is, after I receive an assessment, what happens next?
As discussed in our last video, assessment is a process. You know, when we first meet you, we want to get some history. We want to understand what's brought you in the door. And after we've collected that information and spent time with you, our assessment counselors determine what's called a level of care, meaning we want to customize programming for you, identify what your needs are, and make sure that we're setting you up with the appropriate services, whether that be in-house at Meridian, also with other community agencies, or solely, you know, with another organization that may best meet your needs. So at Meridian, we offer a variety of programs to help folks. But say you come in and you have an assessment and you've been determined to be appropriate for detoxification services. Detox is a medically managed program. At Meridian, we don't necessarily have a detoxification program in-house. So what we would do with you is work with you to identify a provider that meets your needs, is able to provide the medical care that you need, and that your funding source that you have available to you to pay for that treatment program is also something that's within your grasp. We want to make sure that you're leaving with resources and you know that after detoxification services, what's going to be available to you. Detox might only be 3 to 5 to 7 days depending upon what's going on with you medically, and we want to make sure that long term you have the supports that you need.
And oftentimes after detox, individuals still want to continue on in the treatment and recovery process. So determining what your needs are, you know, is an important part at this phase as well. For some people, they want to engage in longer term treatment, living at a facility that's called residential treatment. And at Meridian, we have residential treatment. And individuals who are in that level of care typically live at the facility and engage in treatment for about 45 to 65 days. And while they're there, they're able to get treatment all day long and get introduced into the 12-step recovery process.
Right. And that program, you know, is offered at Meridian, like Julie said, but there's other agencies that offer it as well. So if we don't have something available for you, we would look to see if there's anywhere else that can help you immediately. Another program that we have that's a little bit more intense is a day treatment program, meaning that you can get counseling 5 days a week from 8 a.m. all the way till 4 p.m., meeting with counselors, getting intensive treatment, a lot of support, introduction into the rooms of recovery, and you know, kind of figuring out what's the most appropriate level of care either before or after. That's important too. Day treatment is something that allows you to kind of separate from your day-to-day life, spend some time with some professionals and other people who are experiencing the challenges and the successes that you are, and being able to identify the next steps of support.
It can be a really nice transition from residential to day treatment.
Right.
And then after completing day treatment, you have the opportunity to engage in what's considered to be intensive outpatient treatment. And that is typically 3 days a week, where you attend group for 3 hours and then you have individual counseling. At this time, you can also have, really during any type of treatment, you can have your supports come in and you can engage in as much individual counseling as you need, as well as case management services.
Right. And intensive outpatient services is offered at most agencies, including Meridian, during the day and in the evening. So if you're somebody that has a daytime work schedule, you'd be able to have group in the evening or vice versa. We want to make sure that you have the supports available to you in a schedule that works around the life that you've already established for yourself. And something that we've failed to mention up until this point is one program does not mean you have to do the other afterwards or vice versa. You know, say you come in for an assessment and, you know, it's just most appropriate for you to do intensive outpatient treatment. That's where you would start. And if you're successful, you'd step down from that into a program called aftercare. If you're struggling in that, then we would talk with you about, you know, maybe it's time to step up to day treatment. We want to meet your needs depending upon what's going on in your life and, you know, what complications frustrations or successes you're having, you can move backwards or forwards throughout that process, and it's totally okay. And it's something that we would work on with you to make sure that you understand and your questions are being answered. After IOP, that aftercare programming generally is about 6 weeks of individual and group counseling where you're getting education on how to maintain the positive changes that you've already obtained throughout your programming, and how do you keep that going so that hopefully you never need to come to our front door again, that you have the support you need and you're able to move on and have the life that you've envisioned for yourself. Something else we offer is just one-on-one counseling. Say you come in, you're struggling, you have an assessment, you're really not sure about what's going on in your life, and you just feel like things are insecure, or you're not sure about how stable they are. We could meet with you just one-on-one. Once a week, twice a week for an hour. You have a counselor that you've begun to work with. You can maintain that relationship for as long as it takes until you feel that you're ready to begin working more independently. We try to tailor our programming to your needs, what's going on in your life, and how we may best be able to support you.
So it's important to emphasize that it really is an individualized process. So not everyone is going to receive the same, exact treatment program or treatment plan as the others. So
just say in your assessment, one of the things that comes out is you've dealt with anxiety or depression for the majority of your life, and in the last couple of years you may have started drinking more heavily than you had been previously. We would want to address that anxiety and that depression throughout the context of your treatment. We are trained in treating mental health as well as drug and alcohol issues, and we would be inappropriate to ignore that those things are going on in your life. We want to make sure that you're getting care for you as an entire person for all of your needs. And if you have more severe and persistent mental health issues, we have a co-occurring treatment program, meaning that we provide care for both your mental health and your addiction issues throughout the program simultaneously, and that can be a long-term program if it's something that you and your assessment counselor identify as being a need. One of the things that we always look forward to is your questions. So if you are watching these videos and you have found yourself leaving with more questions than answers, feel free to go on our Meridian webpage and submit questions through our Contact Us section of our site. We'd be happy to, if able, address them here in these videos. If not, we can send you a reply directly. So please visit our YouTube page or our website, meridianhealthcare.net, and share our videos, like us, follow us. We're looking forward to many more opportunities to share some time with you.